Katrina, you want us to share the PowerPoint?
Yes, did we decide, Robin, that that's?
Yeah.
I don't see it. I didn't get an email.
No problem.
I'm happy to share it, but you can too.
Yes.
Yeah, I think Katrina, you were just going to open us real quickly and introduce Dr. Liz, who would do the first few slides and talk about how we're going to do introductions after that.
I was preparing my screen. We're going to do a little housekeeping first, and then we're going to do introductions because we added a little short little exercise to go with it. So Dr. Liz is going to take us through our some of the goals that we have, some which have already been stated, but she was going to do that for us. And then I'll be back to talk about introductions.
Thank you, Katrina. Now, I want to confirm that everybody is able to and see the PowerPoint.
Mm-hmm.
Oh, awesome. Okay. So a lot of the info in the first few slides has been already reviewed. So I'm just going to do some quick highlights. Give me 1 second.
Entonces va a resaltar los puntos salientes. The Spanish interpreter will need to ask in Spanish if anyone needs the interpretation. And do you have the ability to put me into interpretation? Otherwise, it will be consecutive. Sorry. Entonces,
Thank you. I think that
¿necesitan interpretación alguno de ustedes? Si pueden levantar con la mano de reacción o indicar de que necesitan la interpretación, sería bueno. Si no, aquí estoy en espera.
So thank you, Amy. I'm not able to see anyone with their hands raised.
I'll let you know.
Okay,
I
so
was going to say, I opened up my screens again too, so I'll keep an eye on it.
so do we need the translator, or is that a question? Just want to make sure I don't need to do anything in terms of any tech on my end. Okay, I'll keep going. Okay, so we're just going to start to move through the first few slides. You notice that in the in the start, I mean, it feels like such a long time ago now, the review of goals. You'll remember that these were around equity and inclusion, but it also talks about specifically the way that we want the goals to unfold or to emerge. And the other slide talks about being able to process, how to identify that not only are we talking about, you know, what your community is, which one you're representing, but your lived experience is also equally important. There will be some of the staff in Boulder County in the working group, and the co-leads have made it very clear that everyone is not either, you know, more important or has more weight in the ways that we talk about goals and reflections. A few rules of engagement that have emerged and that we're asking to provide and to share is those that are essential, like to listen with an open mind, attack the problem, not the person, record outcomes and with follow-up, but really to come into our meetings with the time that you've had to prepare, to read other items, so that we're able to really be effective in our process. So lastly, we had a great presentations throughout the day that really leaned into inclusivity, being authentic and transparent. And as we try to move through the sessions, it would be great to identify which are these principles that we will hold on to and to use in our work in our work as a group. All right, co-leads.
Yes, what we'd like to do to start, because not everybody knows everyone, and we didn't introduce in the first part this morning, is just as you're introducing yourself, your agency and the community that you're from, let's include a sentence or a word that describes your idea for a vision of a healthy Boulder County where everyone's mental health and social resilience is optimized. This hopefully will get some of our juices flowing and switch our brains from what we've heard all morning and focused on this mental health and social resiliency. I don't know, Robin, if everybody or just the 9 people, or I guess if you want to introduce yourself and are going to be a part of this discussion, please go ahead and introduce yourself and give us your vision of a mentally healthy Boulder County.
And Amy, could you put the slide down so we can see everybody?
I don't have control. I'm not sure. I think
Yes.
Dr. Liz is.
Yes.
Sorry.
1 second.
And I'll go first. I'm Katrina Harms. I represent the Peak to Peak Housing and Human Services Alliance and the Netherland Food Pantry in Netherland. And we work with the Peak to Peak Western Boulder County Mountain Region. Oh, and my idea of the best Boulder County is that mental health and social resiliency are held equally with medical health, physical health, so that everybody has the same access in the same capacity and way for health in general. Robin?
Great. And I'm going to ask the county staff just to listen, since we have such a large group today and we have less than 2 hours to get through a lot. So I'm Robin Bohannon. It's nice to see many of you who I know, and I'm looking forward to meeting the others who are on the call today. I'm the Director of Boulder County Community Services and Service co-lead with Katrina on this call. And I'll pick on Commissioner Jones.
You didn't give your vision.
Oh, my vision. Thank you. Equitable access with no stigma.
Thank you.
I'll do what Robin said. That's a good one. And what Katrina said, Matt Jones, Boulder County Commissioner. The opportunity, the access for help when you need it. And who will I pick on? Here we go. Oh, Julie Pillar, of course. I'm picking on Julie.
Thanks, Matt. Nice to see you. It's been a while. So I'm Julie Pillar, and I'm just choosing one word, connected. And I will pick on Desiree.
I'm just going to jump in here. Sorry, but we do need to do the Spanish interpretation for the recordings we were just told. So
Okay.
if you guys can jump in, thank you.
So my name is Desiree Furley, and I currently work at the Boulder County District Attorney's Office, but I am also a resident of Boulder County, and I have had the honor of working with the Area Agency on Aging, Workforce Boulder County under Robin Bohannon with Community Services. I think my vision is a place where I know where I can go to seek out mental help for myself and my family.
Okay.
Someone
And-
can jump. Yeah.
Just 1 second for the interpretation. Either I'm going to do it consecutively, or do you have the does the host have the interpretation globe that she can put me in?
How do I do that?
Do you see a
gotcha.
globe? Do you see a globe at the bottom of your screen?
Nope.
Okay, so this is not an interpretation. Okay, so we're going to do it consecutive, and it'll take a little longer, but it'll be fine. All right, let's go.
I'll popcorn over to Kathy.
Y ahora, Kathy.
Okay. Hello, hola a todos. I'm Kathy Partridge. I'm a community member. I'm a family affected by the mental health crisis, and I am here so that families like mine, families like those connected through our grassroots advocacy organizations, volunteer groups, y familias como mi compañera Felicia, todos están seguros, that all of us are safe and able to get the mental health care we need without danger here in Boulder County. And I won't go into the stories, but I come bearing a backpack of stories from people all over our community. And I feel honored to be here in the role of a community member. And I will go to, this is, let's see who's still not here. El persona de el Centro Amistad. Hola.
Jorge, deme un segundo, única para que salga en la grabación. Kathy Partridge, miembro de la comunidad. Ella tiene a muchas personas dentro de su comunidad muy queridas que han sido afectados por la crisis de salud mental, y ella quiere un lugar, un entorno donde ellos pueden percibir y recibir ayuda sin sentir peligro. Gracias.
Hello, everyone. It's nice to see you all. My name is Jorge De Santiago. So I'm the executive director for el Centro Amistad here in Boulder, and we do work with a lot of Latino families in the whole county. I think the word that I would like to use for this initiative will be wellness, mental well-being without barriers.
Porque de Santiago trabaja para Centro de Amistad aquí en el condado de Boulder, trabaja a nombre y a favor de muchos de las familias latinas, y él quiere una salud mental que se puede recibir la salud mental de manera plena.
And I will pass this to Ellie. Let's see you, Ellie.
Hi, good to see you, Jorge. Hi, everyone. I'm Ellie Johnson. I'm with Together, formerly known as Attention Homes, and we work with young people currently experiencing homelessness or facing homelessness. And my vision, I keep going back to this idea of a sense of belonging through access without any barriers. So I think that sense of belonging is critical to mental and social resilience.
Yo me llamo Ellie Johnson y yo trabajo para Together, anteriormente Attention Homes, y trabajo con los jovencitos que se ven sin techo. Y mi visión es que la gente pertenezca por medio del acceso.
I will popcorn over to Allison.
Hi, my name is Allison. I work for Boulder County Public Health, A, she, her, hers. And I think my vision would be that any door is the right door in Boulder County.
Allison, y trabajo para Boulder County Public Health, y mi visión es que cualquier puerta es una buena puerta.
And I'll pass to Jenna Clinchard.
Hi, everyone. I'm Jenna Clinchard. I'm the executive director for Rise Against Suicide. We help young people that are struggling with suicidal ideation, and we connect them with a mental health care therapist and pay for it. My pronouns are she, her, hers. And when I think about mental health, what comes to mind is breaking financial and social barriers to mental health, so everyone can receive the same services. And I will popcorn to Jennifer.
Sí, yo soy Jenna Clincher y trabajo para Rising in Suicide. Nosotros trabajamos con jovencitos que tienen riesgo de suicida, ideación suicida, y queremos conectarlos. Nosotros trabajamos para conectarlos y a romper cualquier barrera que exista al acceso de servicios.
Hi, everyone. I'm Jen Leos. I am the co-CEO for Mental Health Partners. And I think my vision is really around whole health that really breaks down barriers for our entire community. So I really feel like coming together as a community to serve whole health needs. And I will, sorry. And I will send it to Craig.
Y yo me llamo Jen Lois y soy directora ejecutiva para Mental Health Partners en nuestra comunidad, y mi visión es una salud global, total, y romper cualquier barrera que pueda existir para que la comunidad acceda a la salud mental y física. Gracias.
Hello, everyone. My name is Craig. I'm the community organizer with the Center for People with Disabilities. And I guess I'll go with a word for my vision, and that would be accessibility.
Soy Craig y soy organizadora para la gente con discapacidades, y mi palabra pues es una palabra: accesibilidad.
And I can pass it to, oh gosh, who hasn't gone yet? About
Johnny
Tucker.
and Chris haven't.
Okay. Yeah, somebody jump in.
I'll jump in. Oops.
Go ahead, Chris.
I'm Chris Current, formerly with the Netherlands Food Pantry and now with Peak to Peak Human Service Alliance. I've been a mountain advocate for 30 years, and my vision is not only access, I want to work so that there are equitable outcomes along with access.
Thank you, Chris.
Yo soy Chris Current. Yo trabajaba anteriormente con servicios de Netherlands en las montañas. Ahora trabajo para Peak to Peak Human Services. Y mi palabra, mi visión no sería solo acceso, sino que un acceso equitativo.
Johnny.
Yes, hi. I'm Johnny Lefevre. I'm an early childhood community liaison for Boulder Valley School District. So I work intimately with young families, and I'm also a community member of Boulder County and Netherlands for about 20 years now. And I guess my vision would be sort of affordable and community-wide access, and also sort of mental health through gathering and events through the community.
Yo sí, me llamo Johnny Lefevre, trabajo para las escuelas públicas del Valle de Boulder. Yo anteriormente también, además, he sido y he trabajado como miembro de la comunidad de Netherlands. Y mi visión no solo que sea costeable, que sea el acceso a la salud mental, sino que sea ampliamente difundido por la comunidad y que este acceso mental se realice por medio de eventos comunitarios.
Is there anyone from the work group that hasn't introduced themselves?
I think Carmen.
Carmen, yes.
Hi, Carmen Ramirez, City of Longmont, and I would say a culturally relevant, holistic approach for all of our community.
Y yo soy Carmen Ramírez, con la ciudad de Longmont, y yo quiero una atención de salud mental que sea cultural, relevante para toda la comunidad. Gracias.
Did we get everybody?
I think
Great.
so.
¿Ya todos?
So Robin, I don't have the slides.
Okay, so I'll pull them up now.
Oops. So we have to come up with ideas today, and we're thinking they need to be transformational, inclusive, all of the things that we've talked about. And the goal is to not get into the weeds. The goal is to come up with some a list of high level ideas, projects, programs that we know we could do that could be replicated across the county. And we don't want to get into the weeds about funding or individual tasks or little things. We want to keep it high level so that we can get a bunch of things on the table, and then we'll discuss some of them and vote on some of them. And then hopefully by 3:20, we can finish up. So the bulk of the meeting will be that. And I'm not used to working with an interpreter, so you may have to holler at me to stop.
That's a good pass. Bueno, entonces ahorita lo que vamos a hablar y de lo que vamos a tratar, los puntos a tratar serán de puntos transformacionales, inclusivos. Mucho de lo que hemos hablado, las visiones que compartimos hoy. Pero eso sí, por favor, no vamos a irnos por la tangente, sino mantenerlo a muy alto nivel, hablar de proyectos, programas, cosas que se podrían replicar en el condado de Boulder para realizar todo eso. Y después de conversar de todo esto y después de anotarlas, vamos a volver al grupo plenario a las 3:20.
So our first task with Dr. Liz and the ARPA steering committee and Katrina and Chris was to look at what the community told us and really organize it into big themes, buckets. What did we hear? We had to look at that list through the lens of what Leslie told us in terms of what might be eligible. And so this was our first lens, our first piece of work on this. So what I'd like to do is explain how we got to these things. And then I want to ask you from your perspective and what you saw from the community engagement phase 1 process, did we miss any big themes that you'd like to add to this list? And we'll also be asking you, are there existing projects that you think fit with what we've talked about today that could be improved upon or expanded? Or are there projects that you know of that aren't happening in our community that you think would fit that lens? So they're responsive to what the community told us, they're ARPA eligible, and they fit some of our goals that we learned about earlier.
Y como vieron ustedes, la doctora, como comentó, y esto, todo lo que nos trae aquí, la doctora Liz, el comité de dirección de ARPA, a mí lo que habló anteriormente la doctora Liz, y luego la lista, el enumerado de diferentes elementos que nos describió Leslie hace un rato. Entonces vamos a primero trabajar con todo esto. Luego vamos a decir, bueno, se nos escapó algo, existe algún proyecto, algo sobre el cual podremos nosotros ampliar, y ya vamos a analizar la fase 1 desde ese punto de vista, de lo que existente, lo que necesita la comunidad y lo que también desean que todavía se incorpora y podemos ver que se pueda incorporar.
So many of you used the word access in your statement. And access clearly was what we heard from the community.
Dijeron acceso, y acceso es exactamente lo que ustedes escucharon de parte de la comunidad, claramente.
Access means lots of different things. So we tried to call out things that were mentioned. So people want help with navigating the system. And the county does have a pilot program that has been up and running. That we've been calling the Behavioral Health Hub. So we've already started to initiate that.
Entonces, pues lo que tenemos nosotros es que, bueno, el acceso quiere decir muchas cosas muy diferentes para todo el mundo, pero lo que vemos es que muchas personas querían saber cómo navegar. Y de suerte, el condado de Boulder ya tiene un piloto para salud conductista que ayuda a la gente con navegar estos sistemas.
We also heard interest, oh, the slide went away, Dr. Liz. Oh, there we go. We also heard from the community as well as from the Urban Institute, this program where we match a behavioral health co-responder to law enforcement so that those who are experiencing a mental health crisis get prevented from entering the criminal justice system.
Y también escuchamos de la comunidad y también del Urban Institute el hecho de que existe un apoyo ampliado de salud conductista, el modelo de correspondiente que ayuda a evitar que las personas que están sufriendo una crisis de salud mental que tengan que ingresar al sistema de justicia penal.
Many people experience access barriers such as transportation, or there's lack of facilities, infrastructure, and we know there's a workforce shortage, which is an access barrier.
Y hemos identificado barreras al acceso y hemos decidido determinar mejores opciones. Y algunas de las barreras que existen obviamente son el transporte, la infraestructura, necesidades de instalaciones y también la baja en el campo laboral.
We heard today a lot about the broadband high-speed connectivity issues that would qualify for ARPA funds.
Escuchamos hoy mucho acerca de la banda ancha, muchas oportunidades que se podrían identificar para poder usar los fondos de ARPA para tener una conectividad de calidad y de alta velocidad.
And we just want to name, even though this may come up in the economic stability working group, that needs to be connected with options for free or low cost access.
Y sé que esto va a estar vinculado con el equipo de trabajo sobre la economía, pero sí, nosotros creemos que esto debe estar vinculado con acceso a bajo costo o quizás con fondos para que se pueda realizar o recibir este acceso gratuitamente.
We know that many community-based organizations are also seeing the need for mental health access. So using resources to support those organizations who may be doing behavioral health services, but also supporting community connections, expanding the definition of behavioral health to the healing arts, as well as some of those comments made with regard to social isolation and resilience.
Y también estamos viendo muchas organizaciones que apoyan a la comunidad, que están apoyando estas conexiones de salud mentales, a veces las artes de sanaciones, quizás inclusive ampliar lo que para nosotros vendría siendo la definición de la salud conductual.
And then lastly, we just wanted to call out that there is significant planning efforts already happening with the state's behavioral health transformation. And Boulder County itself has been involved with community partners and local governments on just beginning a behavioral health and opioid settlement planning strategy.
Y pues también aprovechar que existen esfuerzos de planeación existente al nivel estatal, por ejemplo, la transformación de salud conductual y también, pues, por ejemplo, diferentes esfuerzos que ya está realizando el condado de Boulder con la salud mental, la salud conductual y también, pues, las cosas que están saliendo a flote debido al acuerdo que se llegó y la planeación del acuerdo de opioides que existe hoy en día. Todo esto.
So the first question for you all is there a big trend, pattern, bucket of ideas that we missed at the high level?
Entonces, hay un nivel alto, de entre toda esta lista, a nivel muy alto que creen ustedes que no se tomó en cuenta.
And then we'll go more into if there's a specific program idea or project that is aligned with these buckets that could be expanded or a new one.
Y si hay una idea de programas que se podría aumentar esta lista, que se pudiera ampliar o inclusive si existe algún programa nueva que se pudiera realizar.
So if you'd like to raise your hand or just, and if we don't see your hand, just speak up. I want to bring people's attention to Carmen's comment in the chat, and then Kathy, I think you had your hand up first.
Y si quieren levantar la mano, quiero llamarles la atención pues al comentario que hizo Carmen, que viene en el chat. Si todos ya la han visto, levanten a medida
Oh my God. Carmen just saved you from hearing my voice say something very similar to that, this idea of community-based mental health, broadly based mental health community was piloted in Longmont, including our Cafecitos, the SAMLA program, and it is somewhat different than resourcing nonprofits. It's resourcing the whole community. There's a lot of great stuff here, detailed stuff in these areas, so I won't do that now, but we've heard interest in programs, school-based programs such as the RISE program, expanding that throughout reaching youth through the reaching youth through schools, and piloting a mental health urgent care center where treatment is offered, not just referral, when somebody brings their family member or goes through the door.
Thank you, Kathy.
Y pues lo que dijo Carmen me parece exactamente lo que iba a decir yo, y sobre todo cuando estamos hablando de la salud mental basado en la comunidad. Es decir, por ejemplo, lo que vimos en Longmont, lo que estamos haciendo con los cafecitos, con programas en la escuela, como el programa RISE, que ayuda a los niños desde joven edad. Y también, y por último, pues también un lugar de cuidado urgente dedicado específicamente a la salud mental, donde se atiendan las necesidades de las personas que acuden allí con problemas mentales. Sí.
Julie, I see you, and then Craig is next.
Just so, I don't
Can
know
I
if it was, oh, sorry.
Sorry, I just want to say, Dr. Liz, were you going to capture these so that we can all
Yep.
see them, go back to them?
Yes, I will. I'm taking all the notes as meticulously as I can.
La doctora Liz está
Absolutely.
tomando apuntes lo más bien que puede.
So the co-responders, there's so much working there. I just think that if we're going to expand it, I want to make sure we capture that there should be culturally responsive staff that are bilingual on the team. And then, do you think we've captured parent and childcare as part of mental health? Because we know that in Colorado, childcare is so expensive, and we've just been through 2 years where a lot of the weight have been on parents to try to juggle education as well as work and all these different things. And I think that parenting can be the cause of so much stress. And so parent supports, whether it's, you know, I think Kathy was talking about the drop-in model of a center. You know, could there be drop-off childcare that was quality childcare that was free for parents? You know, just thinking big.
Bueno, Julie pensando muy en grande aquí, que primero, si estamos hablando de la correspuesta a un incidente de salud mental, que estas personas sean culturalmente adecuadas, que sean bilingües, esta parte del personal. Y ahora, otra cosa que ella abundó un poco más en el tema de que pues los padres se ven estresados, sobre todo en un estado como Colorado, donde pues es tan caro, pues eso de la guardería, y eso podría ser parte de la salud mental. Parte de la salud mental podría, a mi parecer, es dar esos apoyos a los padres. Quizás tener una guardería gratis, donde puedes dejar a los niños y tener ese espacio. Así que para mí quizás sea un sueño en grande, pero eso me parece que hace falta agregar esto cuando se habla de la salud mental. Gracias.
Okay, Craig.
Hello, this is Craig with CPWD. I think some very high level stuff that I want to make sure we address before we get into any of the details is with just general accessibility, and that's equal access to the information, to make sure that not only everyone has access, but access for accessing the information. So I'm talking more about website accessibility and document accessibility, making sure everything is screen reader compatible and materials are being produced in multiple formats the first time, to make sure that everyone can reach them. And that includes surveys, and also understanding that this new reliance on technology, that a lot of people don't have access to the underlying technology to even access broadband. So that needs to be a part of the conversation. And then the realization that with this increased reliance to technology, we still have a lot of people from our community whose only line of communication is landline telephones. So to make sure that there's multiple forms of communication utilizing landlines, and not just a reliance on computers and tablets and text messaging and so forth.
Bueno, yo soy Craig, soy CWGE, y para mí lo importante es el acceso por igual a la información. Y eso quiere decir, pues, tener la información en páginas web, en documentos, en los lectores de pantallas. Y se tiene que producir en muchos diferentes formatos, tanto las encuestas o cualquier tipo de información que queremos hacerle llegar a la gente. Y además, no todos tienen asegurarse de que inclusive tengan la tecnología, acceder el broadband, la banda ancha. Y pues acordarse que a veces la gente no tiene los dispositivos para acceder la banda ancha, aun si lo tuvieran. Y asegurarse que hay gente todavía que solo tienen un teléfono fijo, y asegurarnos de que todo esto, que toda la información, toda comunicación tenga en cuenta todos los diferentes medios de comunicación disponible. Gracias.
Thank you. Jenna, I think you're next.
Thank you. And thank you to the interpreter. I appreciate your service. So what I've seen over the past 2 years that I hope the county and the city wants to focus on, I'm going to kind of echo a little bit about what Julie said with parents. We don't have enough help for parents, and we don't have a place for the parents to go. And I'm gonna talk about mental health, but I'm going to be a little more specific. I'm going to talk about suicide, because we have to talk about it, and there's a stigma, and I can't see it get looped in with the mental health anymore, because what's happening is kids, adults, parents are dying from suicide, and we have to kind of try to separate it from other mental health services that we offer. And I think I'm hoping that now is the time that we can do something like that. And of course, it's going to have to be bigger picture, but it's going to be reaching, of course, I can share from a youth and parent perspective, because those are the stories that I get, and that's the field that I work in. But I imagine as adults, it's just as bad. We've seen the ER visits. And so how do we get ahead of this now? We're already behind it, but how do we get ahead of it? Because it's not going away. And so do we need to separate the services? Do we need separate suicide services in Boulder County, and then offer other services? Is that something we need to be looking at? Do we need to have a specific place just for suicide? I also think if we do something like that, we need to separate youth, and we need to separate adults. They can't be served the same. I think we have too many programs trying to serve adults and trying to serve youth the same, and it doesn't work. First of all, our therapists are different. The therapists that serve our youth are different from our adults, and they all have different needs. And so to ask therapists to serve everything and just kind of have everybody show up and it's a smorgasbord of people, it's not working. Our system's failing. And so I guess those were my two thoughts. And as you can tell, I'm fairly passionate about it, but I'm also willing to put the work in to get it done for people that are struggling with suicide and their families that are left behind, unfortunately, that don't have the help that they need either. And the other thing is, when we think about suicidal youth,
Hey, Jenna, let's let the interpreter.
Oh, I'm so sorry, Rosabelle. I just went on for like ever. I forgot. You could have interrupted me. Sorry.
You had a good spiel going. Okay. Jenna, me llamo Jenna y pues mira, yo durante los últimos 2 años he trabajado muy fuertemente a nivel ciudad, a nivel condado, y veo que los padres necesitan ayuda, o sea, no tienen lo necesario. Pero sabes que yo voy a entrarle de derechito a lo que en realidad lo que me preocupa y lo que veo como el problema mayor, y eso es en cuanto a la salud mental. Y sabes que no solo la salud mental, sino el alto índice de suicidio. O sea, porque no me gusta que juntemos la salud mental y el suicidio todo en el mismo barco, porque son tan diferentes. Y veo que hay padres que se mueren, niños que se están muriendo. Entonces, y yo veo que se necesita separar la salud, pues la atención al suicidio de las demás salud mental, porque eso es algo más grande, un lente mayor. Vemos a jóvenes y a padres que se ven afectados y pues cuando, o sea, ¿y cómo se ve para ellos? ¿Y por qué tanto suicidio, tanta gente que está llegando a la sala de urgencias? Nosotros tenemos que quizás ya ponernos a la delantera en vez de a la rezaga de la atención de este tipo de situación. Entonces, para mí, yo diría que hay que separar primero y principal el suicidio de la demás salud mental y luego tener un espacio específico tanto para adultos como jóvenes, porque ahorita los estamos atendiendo con los mismos médicos y la atención pues del suicidio para los jóvenes difiere mucho de la de los adultos, así que yo creo que se necesita hacer la diferenciación y esto es algo importante que yo quisiera hacer, yo sé que soy muy ambiciosa y soy muy apasionada, pero soy el tipo de mujer que yo sí le entro de pleno a las cosas a las cuales me dedico.
Thank you. Jenna, did you have an additional thought?
Yeah, and then just another thing I wanted to share with all of you. Unfortunately, when someone does die by suicide in our community, we all know that causes more trauma. Right? Trauma. There really isn't a lot of places for people to go. So how can we create a space for whether it be youth, whether it be adults? How do we create that space? Going back to what we were talking about earlier, do we create that within faith communities? I've had a lot of people reach out to me in faith communities asking where to go. Do we do that at Boulder? So I think there's many ways, but that's my thought and what I would like to see added in if that's possible.
Y lo último que quisiera compartir es, recuerden, cuando alguien muere a raíz del suicidio, hay trauma, hay más trauma y más trauma que resulta ya sea por un joven que se suicida, un adulto y todo, y no existen esos recursos para abarcar con ese trauma y pues han hablado conmigo de las comunidades de fe y pues no sé si es de comunidad de fe, si es Boulder, pero sí es algo que yo quisiera que le prestáramos atención a esto. Gracias.
Thank you. Carmen, I see your hand is up.
Yes, sorry. I just wanted to mention that specifically folks that were dealing with COVID loss. So I have families that lost not only a loved one, but maybe the primary breadwinner. They now have to be in charge of children. And there's a lot of stress and mental health issues that go along with that, in addition to the social resiliency of connecting them to resources. The other group that I think we should consider is, and I've got one, I've heard people refer to them as Covet babies. These are children that were born during this time and were their families were isolated and disconnected. And so from a social and from a mental health perspective, we've got those families. And specifically, it really are low income and families of color. I think there's a huge impact around that. I can't tell you the number of hours that I've spent with some families that have lost someone and they don't know what to do next. And then the systems are just such a challenge. So I think that would be helpful. Sorry.
Carmen, ¿quieres repetirlo en español? Tú sabes tus ideas mejor que yo. Adelante.
Bueno, sí, primeramente estaba pensando de las familias que han estado impactadas por el COVID, que perdieron a alguien, un ser amado, que quizás era la persona que era el principal ganador en el hogar. Y ahora tenemos a alguien que no nomás perdió a su ser amado, sino que también tienen que asesorar cómo navegar sistemas, cómo encargarse de la familia. Y luego los otros es lo que le nombramos Covet Babies, los niños que nacieron durante este tiempo que han estado aislados o desconectados, pero también que tienen estrés alto de salud mental y de resiliencia social. ¿Todo bien, Rosabel?
Muy bien, muy bien. Very well.
Mika, you need to close your...
Can you please mute? We love that you have a baby, but it's a little distracting.
Sorry.
All right, so anyone else, especially if you haven't had a chance to weigh in, have any thoughts about what's been expressed so far, or any thoughts about the big themes? Other projects?
Hi, Robin. I can just go. I was going to put it in the chat, but I'll just say it live. I wanted to tag on to, I think, what several others have said, but Desiree, regarding the workforce. I think what's critical is the workforce crisis right now, and just that any ideas that were presented are not going to be successful unless we can really think about workforce challenges, both from a culturally competent perspective and just in general. I think the past 2 years have had huge impact on the workforce working in the behavioral health field. And I fear that the continued access challenges will be exacerbated by the workforce crisis.
Sí, quisiera unirme a lo que ya han dicho, ¿no? Pero por en suma o además de lo que acaban de decir, es esa crisis que tenemos en el campo laboral. Entonces, pues todas esas ideas son excelentes, pero al menos que nosotros podemos dirigirnos al problema que tenemos en cuanto al campo laboral y sobre todo en el cuanto de consecución de pues gente culturalmente competente. Yo trabajo en el campo de salud conductual y yo veo que eso es un problema y es algo, un problema de tener de acceso que vamos a tener a no ser que pues abarquemos ese tema. Muchas gracias.
Thank you, Jen. And I know that's a complicated problem. That it's about money, it's about salaries, but it's also about professional development and people just not in that queue or the pipeline for hiring. Is that true?
Y Jen, yo entiendo y yo sé que se trata de dinero, sueldos, desarrollo profesional y el hecho de que no hay gente pues que está en cola para trabajar en este ámbito de salud mental. ¿Es así?
Yes, I would agree. I think it is. It's just around how the salaries are, maybe not where they need to be, but also I do think it is absolutely pipeline, which I think others had put in. I think just looking long-term at how we can help support people getting in the field to be able to do this work. And I know there's a lot going on at state level too, but it is definitely affecting our community.
De acuerdo, tiene que ver con los sueldos, obviamente, pero también el oleoducto, para asegurarnos que a largo plazo podemos tener a gente que esté dispuesto y que quiera estar en estos trabajos. Es algo que tenemos que trabajar, obviamente, a nivel condado, pero a nivel, pues, estado.
And thank you, Dr. Liz, for capturing the comments in the chat for our spreadsheet and prioritization process. Ellie wanted to make sure that we're not forgetting the mental health crisis and the need of the unhoused, for sure.
Y gracias por anotar toda la información, doctor Liz, y queremos asegurarnos de seguro que no se nos olvide hablar de abordar el tema de la gente sin techo.
All right. Any other thoughts before we start our next process? And I know for myself, I need to remember to breathe through this conversation because it's hard.
Algo más que quisieran pensar, o últimos pensamientos antes de seguir con el siguiente proceso. Y yo inclusive tengo que acordarme de respirar, porque yo sé cuando empiezo a hablar de estos temas, a veces pues se me acorta la respiración.
So Dr. Liz, I don't know if you're ready. You've been capturing this on a spreadsheet. And we have some thoughts about, again, we have 2 more meetings after this. We thought we would get your ideas and feedback and thoughts on what we heard from the community. And then ultimately, we will only be bringing just a few projects forward to the commissioners to consider. So we probably have about 25 things now. And many of those things need to have a little bit more research on to make sure they're ARPA eligible. But we thought we would start with just our first attempt at looking at the list and seeing what we have and seeing what really speaks out to us in terms of moving forward and doing more work on. So if people are right, we can move into that. Dr. Liz, if you're ready.
Entonces nosotros vamos a hablar de retroalimentación, pensamientos, y vamos a hablar en la hoja de datos, estamos anotando pues todos los pensamientos del día de hoy, pues si tenemos dos reuniones más, pero ya después de eso pues se va a reducir todos los pensamientos sobre los proyectos bueno, apenas 2 o 3, no muchos. Y ahorita tenemos 25 cosas que quisiéramos hacer y cada uno de ellos tenemos que investigarlo para asegurarnos de que esto sea apto para ARPA. Así que es nuestro primer intento. Así que lo que vamos a hacer es seguir adelante con este proceso. ¿De acuerdo? Y la doctora Liz va a poner la siguiente diapositiva.
Okay, can you see my screen?
¿Ven la pantalla?
No.
Liz, can I go ahead or maybe just be put on the queue to talk about the responder program and some views from around racial justice?
Podemos poner hasta abajo las cosas en cuanto al programa de los respondientes y hablando de la justicia racial, si se puede.
Kathy, go ahead.
Kathy, adelante.
Okay. I noticed on the list that it described the co-responder program, which is a specific name for a program where mental health, often EMTs, ride along with police and respond. And though our groups agree that those services should be 24/7, there is a way of providing mental health response, which is not police-based and which is being promoted by the Boulder County NACP, as well as allies like Together Colorado. Denver has a program called the STAR program. And I've also heard in my conversations in SAM here in Longmont that having police come to mixed documentation and undocumented households, people just aren't going to call the police. So I'm hoping in that list that it talks about not just co-responder, but this alternative responder program, which can be, as we've seen in Denver, more culturally appropriate and less threatening and fearful for people. And they were, it's not exclusive of each other. In Denver, these work in different settings, but yeah.
Yeah, that's great. Thank you for adding that, Kathy.
Entonces, yo creo que quise agregar es el correspondiente y eso es básicamente, yo sé que ese programa de lo que se me acaba de mencionar tiene que ver con pues un técnico de salud de emergencia con un policía que van juntos 24/7, pero en realidad se ha comprobado eso no atiende tanto las necesidades de salud mental como lo que tenemos, que como existen algunos programas de respuesta alternativa en el condado de Boulder, que también es, que es aplaudido por NAACP, por Together Colorado, por el programa STAR de Denver y también ha existido este programa en situaciones, por ejemplo, en Longmont, cuando pues llega la policía, a veces pues ni siquiera se atienden las necesidades cuando son comunidades mixtas, gente documentada y no documentada, y mejor es este programa alternativa porque es una manera de responder de manera cultural y trabaja a la par con quizás las respuestas de emergencia de la policía. No es excluyente de ellos, sino que es una forma de ayudar a la gente con situaciones de salud mental. Así que quisiera que se tenga en cuenta este tipo de programa que se podría llamarle una respuesta alternativa a la de tener que abordar una emergencia con policías. Gracias.
Jenna, I see you hand up.
Yeah, I just wanted to say that we work with the CORE program in Longmont, and it works really well. Of course, we only accept young people, but part of this isn't just about keeping people out of jail. It's about keeping them from going to the hospital, especially young people, because what it does is that increases trauma if they end up going to the hospital or into the system in any way. And so I absolutely love this program, and I love that Boulder's doing it as well. I think what's going to be important, though, that we may want to put on our list is that there is a place for these co-responders to refer these people. So a place outside of the hospital, like the co-responder is great and the police are great, but they need a place for those people after that step. So I just wanted to throw that in there so we can put it on the list when we talk about it.
Y yo quería mencionar el programa Core en Longmont, que es un excelente programa que ayuda a los jóvenes los jóvenes y los mantiene fuera de la cárcel, del hospital, o sea, y ni siquiera tienen que entrar al sistema, porque esto ya es traumatizante, así que lo que nosotros, entonces, es algo que también lo han usado y lo están usando con éxito en Boulder, porque hay un lugar a donde los correspondientes pueden recomendar a una persona y puede ser en un entorno, y es en un entorno fuera del hospital, y también fuera de tener un roce con la policía, así que yo quisiera altamente que nosotros tomáramos en cuenta este programa. Gracias.
Robin.
Yes.
I just wanted to do a quick time check, and we've heard from a few people, but I would really, really like to encourage someone who hasn't spoke to speak, please. I'm not going to call on anybody, but unless I have to. Please.
Quisiera pedirle a alguien que no haya hablado todavía a que hable. O sea, no les voy a obligar, pero pues les motivo altamente que lo hagan.
I think most working group members have either spoken or have put things in the chat.
La mayoría de la gente ya sea pues han hablado o han puesto cosas en el chat.
I think one of the things that we suffer a lot in the mountains is access becomes a location. We don't even have a place for people if there were staff. And so when we talk about access, it has to go even to be the one little place that we don't have to have that. So making sure that the communities have the physical places, and I like the community part of it, but even our churches and and that's the only other one I can think of, we just don't have community spaces either. So, and we have a community that's, 40 miles long. So the places that we do these things, that we provide the mental health services and assist with social resiliency, need to be put together and included in this in this process.
Y en las montañas tenemos que tener en cuenta el acceso a lugares, es muy limitado, no hay lugar inclusive para el personal, así que si estamos hablando de las montañas hay que tener en cuenta el dónde ponerlos. Por ejemplo, pues hablamos de las iglesias, sí, quizás, pero son comunidades que son 40 millas de largo, así que para mí es bien importante, si estamos hablando de la resiliencia social, es tener el lugar, el tener en cuenta que nuestras comunidades son distintas.
Great. Robin, I'm sorry I keep talking, but I'm just passionate about this topic. And I agree with Katrina. If we can't have facilities, mental health facilities, we have to figure out how to meet the people that need our services where they're at. Like for RISE, like we go into schools. So we can go and we can meet those. Like we're in Netherland all the time. We just served like 6 kids up in Netherland, but we met them in their schools because there isn't a location outside of there to meet them. So I guess what I'm saying is, yes, Katrina, we do need locations built. And I'm hoping people will hear this and build locations. We even need places here in Lafayette. Really in the community down here, we don't really have enough locations for people to be met. And that's another barrier for therapists, because therapists feel like they have to pay rent on an office, and not all therapists can afford to pay rent on an office. So if we could take that barrier away from the therapist, they may be able to go to a location that's open for them to offer their services. Just another thought, Robin.
Sí, muy apasionado. Yo dispense que hable tanto, pero soy muy apasionado en cuanto a lo que concierne la salud mental y el tener lugares para poder dar los servicios. Por ejemplo, pues RISE entra a las escuelas. Si vinieron a Netherlands y pudieron atender a 6 niños ahí mismo en la escuela, pero muchos lugares no hay dónde atender. Por ejemplo, inclusive si podemos hablar de Lafayette, no hay lugares y a veces pues los terapeutas no pueden pagar por el alquiler de un lugar y por lo tanto no pueden prestar los servicios. Así que sí, sumamente importante todo lo dicho, pero hay que subrayar que tenemos que tener un lugar para realizar los servicios. Gracias.
So first of all, no one needs to apologize for participating. This is why you're here, and your comments are so valuable and spot on, and it's going to be a hard time sorting through them. So please don't stop participating and don't apologize.
Y no deben de disculparse, sus comentarios son valiosos, o sea, no, y va a ser bien difícil tratar de ver cuál de los proyectos les va a tocar los fondos porque todas sus ideas son muy valiosas, así que no se les ocurre disculparse por participar, para eso los tenemos aquí.
Craig, I see your hand up.
Yes, thank you. I just wanted to mention something that goes hand in hand with kind of the increase of physical locations in our community is we really need to address the lack of accessible transportation options in various communities, which has been a really big factor that increased isolation within our community. And we've learned also that the reliance on public transportation was really affected by the pandemic and got shut down. And for a lot of health reasons, people decided not to use it. And then with very few accessible transportation options, you're really homebound and stuck in your house. So until we can, increase accessible transportation options, that's still going to leave a lot of people without access to these brick and mortar facilities. And I know that accessible transportation is really affecting our mountain communities as well, and just our communities in general. So I think while we talk about having the infrastructure in in-person facilities, we have to kind of address the first mile, last mile concern as well, make sure people can actually get there to utilize and take full advantage of the community resources.
Muchas gracias, gracias. Y sé que se mencionó pues los lugares efectivos, pero también hay que hablar del transporte y del aislamiento que se sufrió durante la pandemia, porque pues la gente estaba usando el transporte público, pero luego debido a la pandemia dejaron de usarlo. Entonces la gente se veía aislada, así que es bien importante que no tan solo tener un lugar físico, sino tener el acceso y como se llama en la industria, tener acceso a la primera y la última milla de un transporte es importante para acceder a los servicios. Así que muchas gracias.
So Katrina, back to your timing and process question. I think there's such a great richness of ideas here. And Dr. Liz, I know you've been valiantly taking notes, but I'm wondering if one proposal would be to do the prioritization offline. So everyone would get sent a spreadsheet and they could review everything that has been named. We have some rating criteria that Rebuild and the commissioners would like us to think about. And because this conversation has been so rich, I'd like to hear more from you. I know that you're thinking of new ideas after you hear someone else. So let me know. We've got about a half hour left.
Bueno, nos resta como una media hora y lo que me pongo a pensar aquí es que qué riqueza de ideas y pues en realidad, o sea, yo eso lo tengo que tener en cuenta, ¿no? Y que quizás podemos nosotros definir los diferentes proyectos fuera de línea usando el criterio de clasificación que nos ha dado los comisionados y de esa manera me ha fascinado escuchar este fermento de ideas hoy, que ustedes pues se comuniquen y pues ustedes sigan comunicándose y usemos el resto del tiempo porque a veces una persona tiene una idea y otra persona pues ahí se suma a esa idea y ha sido algo muy placentero. Así que sí, quizás podemos seguir de esa manera.
If I could make a suggestion, I think the only things we were supposed to have a list and then do some prioritizing, but we can create a survey and send that out and then get feedback from this work group and do some prioritization and then be really, really prepared on the next meeting to talk about more specific projects and programs. If that makes sense. Again, yeah, I'm happy for people to keep talking. I think the only thing we really wanted to do is just talk about that last meetings, or the next meetings.
Entonces, bueno, podemos poner una lista y darle prioridad y todo eso, pero pues en realidad, y podríamos hacerlo así, ¿no? Lo hacemos y luego seguimos, pero lo que sí creo que tenemos que hablar o identificar quizás son los últimos proyectos y programas de las cuales se hablaron, pero aparte de eso estoy totalmente abierta a que sigamos hablando.
Kathy, you have your hand up.
Yeah, since we're still talking ideas, my main concerns from community level folks are on the list, but this idea of a mental health urgent care model, just thinking our county commissioners want to see innovation and, big change, earth shattering, exciting new ideas. And this came from a top level psychiatric leader of inpatient nonprofit facility in Boulder County, this idea of having a clinic like an urgent care clinic, but that actually provides services right on the spot rather than referrals or a waiting assessment period. And apparently this has been done in some private settings for mental health, but I'm just putting it back in there because I recall in these early meetings and here's Matt Jones here with the county commission, the idea to be, big new ideas. So it's not my idea, but I really respect the person whose idea it is.
Bueno, yo estoy avanzando con eso de la salud, cuidado urgente para salud mental y todo eso, pues yo lo que me acuerdo es que debía de ser pues algo novedoso, algo que jamás se había hecho, algo pues impresionantemente diferente, ¿no? Pero entonces lo que estoy viendo aquí es que el líder... y fue un líder psiquiatra de una organización sin fines de lucro que había dicho y había propuesto que en el condado de Boulder abrir pues una institución de cuidados urgentes para salud mental donde ahí mismo te atienden sin tener que recomendar, sin tener que esperar pues las evaluaciones, y pues veo que es algo bueno y todo eso. Por aquí está Matt Jones que nos puede decir que si se puede usar una idea de este tipo, no, y sin falta de respeto, me parece muy buena idea, pero pues no sé si eso es necesitan cosas más grandiosas, más a un nivel más alto. Eso pregunto. Gracias.
And Jen and Kathy, I just want to make sure that we have the same level of knowledge and information. And so I was wondering if there's a difference from what Kathy described with the crisis stabilization unit, and if you two would sort of sort that out for us.
Y Jenny, Kathy, si ustedes quizás pueden explicarnos acerca de si hay la diferencia o las similitudes con la unidad de resolución de crisis, nos podrían ayudar.
Kathy, do you want to go first in terms of what? Oh, so just, I mean, I think in terms of that language can be really hard. And I know from a state contract crisis, foundation, which we have some of that, there's which we have a crisis walk-in, right? So it's a walk-in crisis where we have living room model, and we also have withdrawal management. And then we have, I didn't know if you wanted to go. And then we have, there's other contracts not within Boulder County where there's ATUs, so acute treatment units, and there's crisis stabilization units, so CSUs. And we do not have any in this county, but the state has contracted with different counties to have those, which our county residents can utilize for that level of care. I think, Kathy, what you're talking about is something is in addition to some of those current programs.
Yeah, it's an addition, because what the doctor was suggesting was like urgent care, that a certain level of care needs could be addressed on the spot. In other words, there would be prescribing physicians or nurse practitioners that were right there on the spot. So it would be in addition to, not instead of, but in addition to, or perhaps as part of.
Bueno, lo que respondió ella a eso es que, bueno, el lenguaje de esto es un poquito difícil, porque sí hay unidades de crisis ambulatorias y también pues otro para administrar la resaca o la adicción, y también, pero eso en realidad es lo que tenemos en el condado de Boulder. Tenemos también cuidado urgente que ayuda quizás con la ayuda de cuidados allí mismo en el lugar, también una enfermera especializada que está ahí para atender a la gente, y lo que es a nivel condado, pues lo que ya tenemos a nivel estado es una unidad de tratamiento agudo y una unidad de estabilización de crisis, y pues la gente del condado obviamente pueden enviar a sus seres queridos allá. Pero entonces lo que dice Kathy es lo que ella acabó de describir, es que eso está por encima y por añadidura a todo lo que se dijo, lo antedicho.
Jenna, I see your hand up.
I have a question. So Kathy, I'm intrigued by this proposition. So when a person shows up at urgent care and they're served by the doctor or nurse, where do they go after? So just a scenario, a suicidal person shows up to urgent care. Are they in there? Are they admitted? Is this a place that has beds? So they're admitted overnight, or do they come in and then they're let out? And if they're let out, do they have a whole plan? Like, are they given a plan when they're, before they leave, like you're going to get connected with this therapist within 24 hours and you're going to be seen by this therapist within a week? Like, what does that look like? Can you walk me through the whole process? I get intake. How does the out dismiss?
Actually, what I would suggest, I have some of those same questions. Dr. Rayburn of the Boulder County Health Psychiatric Wing, the director of that, has this idea. So I think the county staff, I mean, I think there's some idea of researching like big ideas, and you know, I have questions like how do you do this and integrate it with what's already available, you know? But this idea of each door is a right door, it's for mental health, it's like, where do you have the doors where people are finding the right door?
Right.
And I just thought, when he said it to me, I thought, you know, we all go to urgent care for, you know, a second-degree burn or a broken bone and or whatever. You certainly don't go there in a mental health crisis. Ask me how I know, but you go to urgent care for a variety of things that you don't use the ER for. So that's kind of his idea, and I'm just really putting it on the table to kind of kick it around and see, hey, is this something that Boulder County might want to follow up with this guy and maybe see if it's important to, you know, pilot a big new idea, see what's going on with MHP and the other programs in the hospitals, and yeah.
Bueno, todo yo mi pregunta y pues sería la pregunta que ella, la primera señora, vamos a empezar por la primera, dice, bueno, una persona va a cuidados urgentes, sí, pues de salud mental y luego le atiende un doctor o una enfermera especializada. Bueno, ¿qué pasaría entonces en caso de si alguien tiene pues ideaciones de suicida? Entonces, pues luego le dan de alta y le tienen un plan antes de que salga, que tiene que atenderse inmediatamente con un terapeuta tal y después de una semana con otro terapeuta. Eso sería un poco de mi duda aquí. Y la segunda señora responde lo siguiente, que bueno, pues bueno, y eso sería una buena pregunta que quizás le podríamos hacer al doctor Rayburn, que es un doctor psiquiátrico a cargo pues del ala de psiquiatría de un hospital en Boulder. Entonces, pues sería cómo se integran estos servicios, ¿no? Porque si hablamos anteriormente de que todas las puertas deben de ser las indicadas cuando se trata de una crisis de salud mental, bueno, entonces, ¿cuál es la puerta que nos conduce a la puerta indicada, verdad? Porque si sabemos de estas unidades de servicios urgentes, es pues el lugar donde te vas donde cuando te da una quemadura de las buenas o cuando te fracturas un hueso, no es el mismo que debería de ser cuando se trata de la salud mental. Así que pues eso sería una buena pregunta que debiéramos de hacer y ver si se podría integrar esto. Gracias.
I want to remind people too that we are looking for transformational. So we do have the opportunity to have some work done on researching and looking at this this particular program to see if it is something then that would be viable and workable and sustainable. So this was good. Way to go.
Y recuerda que estamos buscando cosas transformacionales, así que si queremos investigar el programa para ver si es algo factible, algo que se puede realizar, también se podría hacer un estudio de este tipo de programa.
So we've talked a lot about the crisis part of the issue. We've talked about the need for the urgent care idea. We've talked about, but then where do people go and how do they access ongoing care?
Entonces hablando de la crisis, el tema de que cuando uno accede a cuidados urgentes para una crisis mental, ¿a dónde va? ¿A dónde se atiende la gente luego?
We've talked about the issues related to specific populations. We've talked about the need to be culturally inclusive, and that means lots of different things. And there's great language in the chat that describes what you all have articulated.
Las diferentes poblaciones, hablando de que, bueno, que debe ser culturalmente apropiado, debe ser accesible, y ustedes en el chat han puesto un montón de definición en cuanto a para lo que ustedes vienen siendo algo que sea culturalmente bueno.
We've talked about issues related to parenting, childcare, the impacts of COVID loss, as well as the impacts of COVID on being a new parent during COVID and how isolating that is.
Y hablamos acerca de ser padres, cuidado de niños, el impacto de la pérdida debido al COVID y el impacto sobre los padres que resultó a raíz del COVID.
And we've talked about the sort of the foundational issue of the workforce shortage and how it's going to impact all of those things.
Y estamos hablando del problema de base, que del hecho de que tenemos una baja en el campo laboral y cómo esto va a tener un efecto, un impacto sobre el proceso.
And then I think the last thing is, not the last thing, but the thing I'm remembering that stood out to me is decriminalizing mental health and removing the law enforcement piece.
Y no lo último, lo que más me salió a la mente era de criminalizar la salud mental, el que uno y el excluir ya a los policías ese proceso.
So Jenna, I'll ask you to speak in just a minute. I just want to close my thought. I think back to Katrina's question about next steps. Again, I would like us to look at all these really brilliant ideas and think about how to prioritize them based on the prioritization goals that we have. But I'm wondering if we want to move into, is there something that we just think just needs to come off the list? Or is there, the top 5 that we really want to make sure we assign to county staff to do more research before our next meeting? Sort of trying to get to what are the next steps. And I'll stop there and call on Jenna.
Entonces, lo que voy a decir ahora, hablar en cuanto a los siguientes pasos que necesitamos realizar en esto, ¿no? Y eso, pues, y no sé cuáles ideas surjan, qué metas desean seguir y todo, pero en realidad lo que tenemos que preguntarnos y ver entre esa lista es que si existe algo, si, o sea, hay prioridades del 1 al 5 de esa lista que queremos que ya le dé seguimiento el personal del condado, o si existen algunos que en este momento dirían ustedes que hay que tacharlos. Y ahora sí, les cedo la palabra.
Jenna?
So I think my last thought too is the barriers that I get concerned about. And I don't know if this is a state issue or a city or a county, but many families, to include the undocumented families that we serve, they don't want to fill paperwork out. And they will not get mental health care if they have to fill out a tree's worth of paperwork. And I don't know if there's a way that we can, like for us, we have 2 documents that a family needs to sign, and that child can be seen. 50% of our kids aren't even supported by their parents, right? And now we know that the state did allow for 12 and under to sign for themselves, but still for those marginalized communities, it's hard enough for them to come out and ask for help for mental health care. I think we have a huge barrier there. So it's not just financial, and I think by breaking that social is by taking some of those barriers down to mental health and awareness. I think like the behavioral health hub, I love that, Robin. Should I stop for a minute?
Y entonces yo quiero decir, y lo que quiero entresacar son las barreras que existen, ya sea a nivel estatal, nivel ciudad, nivel condado, Y esto viene siendo, por ejemplo, muchos de mis clientes indocumentados, pues no reciben atención médica porque no están dispuestos a firmar pues casi un árbol de papeles, ¿no? Nosotros lo hemos limitado a 2 páginas y en algunos sectores hoy en día inclusive ya les permiten a los niños de 12 y menos pues, firmar por sí mismos, ¿no? Pero esos son cosas que son difíciles de superar, es difícil de pedirle a nuestra clientela todo esto, así que son barreras que a veces son obstáculos altísimos y son obstáculos que son mayores al obstáculo económico.
Thank you. And okay, the Behavioral Health Hub, I love it. I think we need to create a huge awareness campaign and get it out in the community. How do we create an app? Can Boulder County create an app to go along with their behavioral health? So as we're giving phones and expanding broadband, can we do something like that? But going back to barriers, my other thing is how can we meet people where they're at? If we can't get transportation, I think barriers is another thing that we have to look at in mental health. There's too many of them up there and not enough people are getting help as a result.
Bueno,
Thank you everyone for letting me talk.
Y que acaba de agradecer por permitirle hablar y lo que acaba de decir, sí, me parece que ese Behavioral Health Hub, que es pues el centro de salud mental, me parece excelente, hay que promoverlo ahorita con los dineros que nos van a dar para banda ancha y dándole teléfonos a la gente, dándole banda ancha, si podemos hacer una aplicación para que ellos puedan acceder a esa información. Así que bueno, pero para mí lo más esencial, lo más importante en este momento sería encontrarme con la gente en donde ellos están. Y para mí eso es el meollo, el punto central para mí de una buena atención de salud mental. Y gracias a todos por dejarme hablar.
So I'm going to call on Jorge and then Ellie, and then we're going to need to talk about next steps. Thank you.
Thank you, Robin. Pretty quick. I mean, I agree with the access, and the feeling of different kind of assessments or applications to join a program. We do have the same thing. We have only 1 page, 6 questions just for families to get access to the program. But also, I think the unique thing that we can actually look at, a couple of the therapists that we work with, they actually do some home visitations where they do the therapy at home because they have no transportation. Technically, they don't feel comfortable just going anywhere. But I agree with that. Try to take down all the barriers for families, especially monolingual Spanish undocumented immigrant communities, to access this service, because first of all, not easy to get Latino immigrant undocumented to access therapy or just mental health support because the stigma that existed still. So we need to be very, very open about those issues, but at the same time, adding the several different forms and systems where they have to sign and they have to provide an ID, it scares them away. So just considering that, as well, as everybody knows, that is crucial for anyone in our community to really have access for their well-being, and especially with the teens that we work with, the same thing. I think a very easy process or applications or assessment that you might do to really provide the full support with no questions, because that's where we tend to send people away. When we start asking questions, what's your name? You have Social Security, you have insurance, you have all that stuff. No, we have to just let them come, offer the service, and provide the support, and let them have maybe 1, 2, 3 sessions, or maybe just 1 session to have a conversation to explore. But this is, believe it or not, it's pretty new for a lot of Latino families to really access this. But in the last couple of years, especially with the COVID pandemic, the stress and trauma and anxiety really increased over 100% with our families and children. So just want to say that. Thank you.
Thank you.
Jorge, ¿lo podrías repetir en español? Pues me ayudaría en este
Claro.
momento.
Sí, es simplemente estoy de acuerdo que se tiene que eliminar las aplicaciones o los procesos de un cuestionario para tener acceso a estos programas. Entre menos sean, mucho mejor, porque en este tipo de aplicaciones muchas veces a las personas que son indocumentadas, que nomás hablan español, se les pide mucha información, se les pide un documento que a lo mejor no tienen, una identificación, inclusive hasta si tienen seguro médico o seguro social. Entonces, eliminado todos estos tipos de procesos, es importante tenerlo en cuenta para poder darles acceso para su bienestar mental, y ya que el estigma sigue siendo un tema muy, pues que vive nuestra comunidad latina por de donde venimos, de los países donde estamos, y tenemos que de alguna manera quitar esas barreras para que la gente se sienta con confianza de tener acceso a la salud mental.
Thank you. Ellie, you had your hand up. Did you put it back down?
I put it down, but I'll try to be quick here. Yeah, and I know Desiree had thrown this in the chat as well, but I think it's so important to bring up kind of substance use and where that falls into this conversation, and how we're thinking about creative solutions to support that, because I think we can't have the conversation about mental health and social resilience without talking about substance use, as our community and country is facing such a crisis with that as well. I know particularly from, the young person perspective, that the young folks that we work with, we often see those two in tandem, and definitely in the pandemic have seen an increase in both of those. And so I would be really curious to learn and know what other communities are doing to kind of couple those two and provide additional supports. And I think much like what we've talked about, there's just a huge gap in where people go when they're not quite ready to go back home, they're not quite ready to go back to a shelter, they're not quite ready to, make that whatever that transition is. And, the many tools we have in the toolbox right now just aren't quite supporting those individual needs. So definitely would love to hear if people have ideas around that, but don't want it to be missed in this conversation about solutions. So.
Bueno, en esta conversación sobre las soluciones, no quiero que se nos vaya a escapar la importancia del abuso de sustancias y crear soluciones al respecto a nivel comunidad, pues a nivel condado, país. Y que debamos de verlo como una crisis que yo he observado entre nuestros jóvenes, este problema en la cual se ven encrucijados entre el abuso de sustancias y la salud mental. Y pues luego hay espacios entre, a dónde pueden ir cuando todavía no están totalmente bien, pero ya no deben estar en el hospital, entre si deben llegar a casa, a un albergue, y las herramientas de apoyo que podemos nosotros dedicarle también a esto, y no cegarnos al hecho de que esto también es algo que se debe de tener en cuenta al hablar de salud mental. Gracias.
I just want to remind everyone we have about 5 minutes left, so probably should transition to maybe homework and next meeting times, things like that.
Vamos a hacer transición a tarea y siguiente horas o fechas de reunión.
So thank you all for this very rich conversation. I think our next steps are for staff to put all of these ideas, that you can look at them all together and then rate them according to the prioritization process that we've been given. And we'll turn that around and send it back out to you so you can do the rating. And I would like you to think about, are there ideas that can be coupled? Are there ideas that can be tucked under one another? Are there ideas that we just really need to set aside for a different time? And at our next meeting, we can review those and decide what needs further research. What more information do you need about existing programs that we talked about that made the list? We'll also work on an agenda for our next 2 hours together. I know that we received an invite to those next 2 meetings today at noon from Johanna. So I want to make sure you check your email. And it's my understanding that not everyone replied to the poll about when you were available. We did the best that we could to meet the needs that people had around days of the week that they could meet. And Katrina just put those in the chat. Thank you, Katrina. So lots of rich conversation, lots of things I would really like, in addition to the prioritization homework, I really would like you to think about what you learned today, what was new for you. And again, we want to make sure it's aligned, that it's not specific to just our group, it's really aligned to what we heard from the broad community, and make those connections. And I'm really looking forward to meeting with you again, because boy, my brain is really spinning with your passion and brilliance and just heartfelt, commitment to this issue. It's very clear that we have the right people in this group, and I'm so appreciative of all of you. So Katrina, I want to turn it back over to you if you have other comments.
El personal entonces va a reducir esto para que ustedes le den prioridad y quizás inclusive al analizar cada uno de los puntos vamos a ver, bueno, ¿cuáles de ellos todavía los vamos a seguir? ¿Cuáles de ellos se pueden juntar con otra idea o se puede poner por debajo de una idea, entre comillas? Así que si pueden ustedes vamos a pensar y tomar todo eso en cuenta. Y finalmente, yo quiero que ustedes pues vean todos estos puntos y veanlos con el enfoque y lente comunitario y recordando que ustedes representan a una voz mayor que queremos hablar luego. Allí en el chat tenemos las siguientes reuniones que van a ser el 16 de marzo de 12 p.m. a 2 p.m. hora montaña. Y también la siguiente, me bajaron el chat, pero lo iba a leer como una parte, es 3:31 de 11 a.m. a 1 p.m. Y me va a dar un gusto y voy a estar tan contenta de volver a hablar con ustedes porque en realidad está por explotar mi cerebro de tantas grandiosas ideas que acabo de escuchar. Gracias.
I don't have much to add. It was great listening to everybody and hearing what I don't always get to hear since we're up in our little mountain island. If you didn't receive a meeting invite, please let Joanna or Amy know, and think transformational, sustainable, integrated. How do we make this work for everybody? And we'll see you all and watch for the next survey step.
Entonces yo quiero pedirles, si no recibieron una invitación, pedirse a la siguiente reunión, se lo piden a esta Joana y hasta entonces transformar cosas que transforman, cosas que solucionan, cosas que integran, cosas que sean para todos. Y hasta entonces nos volvemos a ver y vamos a regresar a la plenaria.
Just a reminder that we're going to be going back to the other room if you're able to join us in that Zoom. It's from the first room that we were in today. I'm putting it in I hope that's the link. That's what I got emailed to me. If not, you can just look at your calendar invite and I will too. With our last minute, Commissioner Jones, do you want to say anything?
Comisionado Jones, ¿quieres decir algo en este momento, de último momento, o estamos bien?
Just thanks to everybody. The passion is real. This is, it's a huge issue, a huge problem. And that was kind of what I was thinking about. And there's so many facets of it, and there's so much that needs to be done. And this the amount of money we have won't cover it. But if we could be real strategic, and this prioritization, I think will help with that, figure out what are the biggest things. And we're going to have conversations about trade-offs. You could put a lot into like one thing and try to change it a lot. And these are the conversations the commissioners have been having. Or you could do more things and probably not have as big a transformative change, knowing that you won't have the money in 4 years, but maybe you can change the system so it works better. That's the kind of thing we're working for. But it's just, I'm appreciative of all your work. Mental health is such a big thing for people, especially with the pandemic. It was before that, and we're short on, the shortage of staff, the workforce, those kinds of things. We had those real challenges before, but this money, I think, can help us move forward in a strategic way, and all of you helping us figure that out is so important. So just thanking you.
Thank you.
Muy
See you in the other
agradecidos a
room.
todos ustedes. Nos vemos en la otra sala. Muy agradecido él. Espera que este dinero rinda y que podamos atender a las necesidades y las cosas que toda nuestra comunidad ocupa y necesita en este momento. Así que, wow, muy buen trabajo a todos ustedes. Gracias. A la siguiente sala.
Thank you so much.
Thank you.